Hi, welcome to Addiction Recovery Plays podcast, the podcast championing addiction treatment professionals around the world. I'm your host, Chris Langley, and I'm very pleased to introduce today's guest, Don Matis. Don is a peer-to-peer support professional from the Susquehanna Workforce Network based in Maryland. They have a very established and successful recovery-friendly workplace program, which provides a framework for employers to support employees and communities around the experience of addiction by highlighting recovery as a strength. Welcome to Addiction Recovery Plays podcast, Don. It's so great to have you with us today.
Good to be with you, Chris. Thanks so much.
No, I really appreciate your time. And obviously, you've been incredibly busy, and especially I've been looking the last week, you've been on the news, you've been interviewed. So I'm very, very grateful for you to spend a little bit of time with us here today to tell us about your work and obviously what's going on around the country at the moment, especially with funding. So we're just going to kick off. Can you tell us about yourself and your career journey and how you're doing the great work that you're doing now in your state?
Oh, well, let me start first, Chris, by saying I'm a person in long-term recovery. So some of the issues that we're going to talk about, I've experienced firsthand, both on the bad side of the fence and now recovery on, I would say, the good side of the fence. But I've been involved with nonprofit work or government work. I've worked for the federal government with the AmeriCorps program. I worked in the governor's office in Pennsylvania. I worked for the Department of Labor, Pennsylvania. I worked for Hartford County in Maryland, where I was a drug court case manager. So I've been involved with this and also a lot of anti-poverty programs like Head Start and Medicaid and drug treatment programs and homeless youth programs. So, I'm one of those very boring, tree-hugging, good do-gooders. What a bad thing to be a do-gooder. And I'm grateful for that. I've worked with some incredible people, both as a private sector person and as a government person at all levels. And that makes the tragedies of what's happening now in terms of funding cuts and personnel cuts at the federal level even more catastrophic. I know we're going to get into that later. But right now I'm wearing two hats. I'm a certified peer recovery specialist at Voices of Hope. Show the logo here, right? I'll get my paycheck.
There we go.
Which is a nonprofit agency that does a lot of great services in harm reduction. And as you also referenced, I'm involved with Recovery Friendly Workplace Program with the local board. I sit on the Susquehanna Workforce Network. And what that does, Chris, it helps people in recovery and their families that have gone through substance use disorder. I'm going to use the term substance use disorder throughout our podcast here, rather than drug addiction. Substance use disorder is a formal medical term for what happens. And drug addiction is more commonly used, but I think it has a tendency sometimes to stereotype more than the medical definition. So recovery-friendly workplace, we help people in recovery get training, job certification, and we also talk to employers saying people in recovery can make good employees. Some of them had careers before they get into their use or misuse, and now they're coming back and they can do that. And what our employers found who've been working with that these people are incredibly conscientious. There's someone in recovery that's not working. I know I screwed up when I was using before. I got and everybody else involved. I'm beyond that now, and I think I'm a good worker. So we talk to employers about that. And what we also do, Chris, is we provide Narcan. I've got a Narcan box here somewhere, which is the medicine that reduces an opioid overdose. And as part of the Recovery Friendly Workplace program, we distribute Narcan and tell the employer, the employees, the workers how to use it. So in case there's an overdose, we're helping employers, we're helping workers. In terms of Voices of Hope where I work, we do wound care services, we do peer support services, we do safe sex services, we do needle exchange programs, we do a lot of counseling. We host and conduct 12-step meetings, and we work with peers. And as you may know, somebody that's been through the life experience with that sometimes is more able to communicate somebody that's currently in that experience. The story I use is meth was my drug of choice, methamphetamine. which was fun until it wasn't. And we had I'd say 35-year-old gentleman come into Voices of Hope who was going through a meth withdrawal thing. And he was not interested in talking to a 25-year-old recovering heroin or fentanyl addict. But the fact that he came in and said, hey, look, I did meth for years. So I understand what you're going through. Let's do that and talk. Tell me how you're feeling. That kind of connection is really relevant. So that's what we do at Voices of Hope, among many other things. And I guess it's fair to say that we're doing a fair number of good things in our county and our state, although with the increase of drugs and the severity of drugs and nitazines and, of course, fentanyl is blossoming, we need to redouble our efforts even more. So that's kind of my story. And I think what the lesson here, Chris, is that in order to be effective in tackling the substance use disorder addiction problem, it's really essential for all components of the community, whether it's the healthcare people, business corporates, chamber of commerce people, the nonprofit people, the leaders of faith from Christian, Islamic, and Jewish all coming together. Everybody, and local elected officials and health departments have to come together to really try to address it. And what the research and evaluation shows is when communities have that joint effort, everybody's participating, there's success. More people get into recovery, more people recover. There's less crime. There's less sexually transmitted infections. There's less HIV. All those are good things. So that sets pace for itself. Of course, the downside that we're facing now is a lot of these programs and the funding sources enable them to happen are being either eliminated or severely at the federal level, which translates to the state level, which then translate to the county municipal level, because some of those funding sources and programs are pass-through grants contained in federal legislation, which is now being threatened, and then goes to your governor's office or your state health department, which can go to your county health department or nonprofits within the area. So that chain, those levels to tiers of service are all in jeopardy right now.
Yeah. So what you just described is the money just goes down the line, and by the time it gets to the people it's supposed to be received by, it's just gone.
No, I wouldn't say that. I mean, it gets pretty well used. I mean,
yeah,
there are legitimate administrative costs for a state to administer a program, for a to administer a program. And at least in our case, Maryland and Hartford County, and I can't speak for where all your viewers are. It's a reasonable amount of money. I mean, the money does get to the programs and what have you. So that's less of an issue than it used to be years ago. And again, what made it happen is advocacy. I think that's going to be one of the themes of our discussion today is advocacy and how you affect these systems, help reinforce what works and the successes, help respond to and maybe turn back some of the real drastic threats to our programs and the people we serve.
Mm. You touched on something quite profound earlier, Don, because you said that you in your community you work with different communities towards the goal of recovery, and with this that breaks down stigma as well. Which once you break down stigma of addiction, it just helps to increase service accessibility for everyone.
Yeah, I mean, stigma has been a longstanding issue that people have. I mean, basically, what it refers to is people think of people that use drugs as having weak character or moral failure, or why can't they pull themselves up by their bootstraps, or da. And what we found through research and what have you, and what the expression we like to use is that drugs hijack your brain, that the cravings become so intense that, well, you think, well, why can't they just say no? Which you may have heard President Trump wants to bring back that program. Interesting. Why can't they just say no? Well, because their brain tells them otherwise. I mean, I was a case manager in drug courts, Chris, and I remember very well, I'd say 35, mid-30s age woman in an orange jumpsuit, in shackles, full shackles, getting ready to go back to jail. And she's talking to the judge. She was a really good judge, saying, Your Honor, I love my husband. I love my kids. I really miss my kids and what have you. But if somebody put a line of heroin in front of me right now, I'd do it in a heartbeat. And that's the kind of craving that addiction really brings about. And that's why it is a use disorder, a mental health issue. So, we've made some advances over the last 10 years. The Surgeon General, Vivek Murthy, did an alcohol drugs study about 8 years ago that really confronted it. Not a moral failure, it really is a disease. And since then, there's been more acceptance of that. And as we work with community groups, they go, oh, yeah, the stigma we thought that these people were dog meat or they just didn't have any willpower. That's not really the case because it is a disease or a health condition, whatever you want to prefer. And it does take over their lives. And once that understanding happens, the stigma starts to diminish and the understanding and the empathy, the need to provide services and programs increases. And that's what we're seeing now. One last little anecdote. When I worked at drug courts, I worked for a great guy, Joe Ryan, who was a retired state policeman. And they were talking about opening a recovery house, sober living house for 8 women in the northern part, very rural part of our county. And the neighbors and farmers up there in uproar, we can't do this. They'll be coming from Baltimore, Sin City. They'll be coming across the state line from Delaware. We'll be attracting all these bad people. In his great wisdom, my boss, Joe, went to the sheriff's office and got the arrest records of everybody who had been arrested for drug use in that area and put pins in a map and went to the next community meeting and said, hey, these aren't people from Baltimore and Delaware. These are your neighbors. These are your kids. And that's who we're trying to serve. So the last stat, about 3 years ago, Johns Hopkins did a survey. 52% of all Marylanders, everyone in the state, knows somebody with a substance use disorder. And once it starts to permeate as a problem, people become more understanding because it happens to them. And they're more open to seeing solutions and less likely to hold on to stereotypes and why don't we just lock them up and throw away the key?
Yeah. That's a really powerful way of getting the message across to show you. And that must have been incredible. And to hear about the shift in attitudes so quickly, just
like that.
One
Yep.
thing. Yeah. That should be done across the country.
Well, to some degree it is. So
yeah.
We're building a movement, unfortunately for all the wrong reasons. The Federal Substance Abuse and Mental Health Services Office in the Department of SAMHSA, which provides funding to Voices of Hope, which we're now going to lose. Those funds are being cut. The Center for Disease Control, there was a CDC worker on a national network the other night talking about how she worked with community drug programs, which Cecil County, Maryland, one of the counties I work with, has one of these community advocacy grants they've had for 5 years. They're being totally slashed. The staff is being slashed. And as a result of that, Chris, there has been an outcry, not just about this, but many other things. Medicaid, which I'd like to talk about a little bit, services saying, wait a minute, what's going to happen? And I know we're going to talk about the end, what people can do to advocate and be useful on this issue. One thing we're doing, and I'm part of some state and national efforts, is we're showing the impact. What if your program went away? What would happen to those people, in those communities, to the lifestyle and quality of life in those communities if those programs went away? And if I can digress for a second and go to Medicaid, at Voices of Hope, we help enroll people into Medicaid. That's the program, the National Health Program for low-income people, homeless people, people with disabilities, and what have you. We enroll people in Medicaid so they can get health services. Right now, the Republicans in the House of Representatives and already approved by President Trump and Vice President Elon Musk have decided they want to make an $858 billion cut in Medicaid. So that means that the people who would narrowly walk into Voices of Hope that we could enroll in Medicaid likely won't get services. So what's going to happen to them? Let's get the consequences for a second. There's not going to be Medicaid. They're not going to get that services from a healthcare provider. Where they're going to go to emergency rooms at hospitals. Emergency rooms. I was on the local hospital board for 10 years, University of Maryland hospital system. I think I know the system pretty well. They're going to go to the emergency room. And by federal law, in every state where your viewers are, emergency rooms have to take these people. And they'll take them without any kind of reimbursement, which means the hospitals are going to end up paying those costs, which means everybody's insurance cost is going to go up. And I don't know what's happening in all the states around the country, but I know in Maryland, we got a notice from the County Department of Emergency Services. If you have the flu or something, please don't come to the hospital emergency room. Go to a clinic or one of these fast stop clinics. Go, because our emergency rooms are so overwhelmed now. If everybody came in, we wouldn't have any room for them. What's going to happen when tens of thousands of Medicaid recipients don't have the services that they can shop around and get treatment or go to urgent care or what have you, or a regular doctor or healthcare provider? They're going to go to the emergency room, and that's going to be crazy. And so there's a lot of consequences we can anticipate with these cuts. And again, for people that are listening, that work in this field, watching work in this field, one thing you can think about is what would happen if your program go away. And the other strategy we're advocating, and I'm sorry to hop around, Chris, you'll have to rein me in, is that people who are policymakers who are most questionable or dubious about services rarely respond to statistics. So if you say, well, we had 80 participants in our program and 40 of them successfully completed recovery treatment, 50% is not a bad number. They're going to go, oh, yeah, so what have you. What they do respond to in a better way is individual stories. They like stories with anecdotes where the person's, at least first name and a face and what their background is and, where they live and what they were coping with and how that process works. So we have a common mantra in our advocacy: no data without stories and no stories without data. So if people can start compiling those, I'm sure they are already. I don't mean to speak down to anybody. I'm sure they have that. But now the challenge is to get them to larger platforms and larger exposure through the media, letters to the editor, town hall meetings, and what have you, where they can really widen the net of people who understand the problem and how we can deal with it.
Goodness me. So you mentioned $855 billion that the administration is planning on cutting. Is that it? I'm just trying to get to grips with that number because that covers Medicaid, Medicare.
No, that's just the Medicaid number.
That's just the Medicaid.
That's just the Medicaid number, wow. And it's important to remember that includes child health. 1 out of every 4 children in the United States is covered by Medicaid. It's 40% of adults. That may be a high number, but a substantial number of adults are covered by Medicaid. And I don't want to sound like I'm too conspiratorial here, so I'll try not to be. But the thinking among advocates and people that work in that system is the plan of the Trump administration and the people that work in that is, and this is what they're going to do with Social Security also, is to downgrade the program in terms of accessibility, in terms of services, in terms of effectiveness. And after the program starts to become less effective because there's less money, less staff, less accessibility, well, these programs don't work. So let's get rid of them altogether. Yeah. And I know that sounds, pretty alarmist and maybe some kind of negative leftist fantasy, but these cuts are significant. So we need to respond to that. And I think, Chris, you and I had also talked about before in one of our brief sessions about the other programs that were related to that. The Supplemental Nutrition Assistance Program, SNAP, which is food stamps. The other programs that people with substance use disorder and low income on Medicaid, Hopkins or SNAP recipients. They get food stamps. And now the notion of cutting that back, and not just cutting that back, but cutting back school breakfast and school lunch programs. I was a former director of our local Boys and Girls Clubs. We had about 3,000 young people who were members of our various locations around the counties. And one thing we've instituted since I left many years ago is they now have a breakfast program, because they found out that many of the kids who were coming to their after-school program, all they had was some kind of school lunch. And they were starting going to school, being hungry, which is not the easiest way to learn things if you're down. So our Boys and Girls Clubs now provide school breakfast, which is wonderful for the kids that want it and need it. Well, that program is being cut. And after school programs, there's a program called 21st Century Schools, which provides after school services. That program is being entirely cut. And that's a program that gives kids 6 to 18 a safe place to go after school. They can get tutoring, they can be computers, they can do art, they can have with friends, they can play foosball, they can shoot pool, they can play basketball, they can play soccer, they can hang out, they can do groups with each other. Those programs are going to be gone. Let me do the cut sign here. What's the consequence of that? Well, school absenteeism might be higher rate. School student performance is going to be lower because they're not going to have the nutrition programs that they had before. Their family lives are going to be more stressed at home because the food stamps, SNAP benefits are going to be gone or significantly reduced. So there's a whole intersection of these safety net programs, as they're called. They include Medicare, Medicaid. Medicare is for the old geezers like me. I'm on Medicare. I'm on Social Security. I work part-time now, but Social Security is a major part of my income. I've been paying into it since I was 20 and I'm 77 now. So I got, 57 years of cash that I've been putting into the system. So there's real challenges. And again, getting back to our primary topic, Chris, this impacts more heavily on people with substance use disorder and their families than it does other people. But again, to be clear, substance use disorder, every zip code, every family, every neighborhood, every gender, every income level, every educational level. It's interesting. I was the director of a national nonprofit organization called the Community Action Partnership. And my last week there, which was a while, I was in Boise, Idaho, Jefferson City, Missouri, and Dayton, Ohio in the same week period. At each of those three sites, Chris, somebody would come and say, Jefferson City is the drug capital of America. Well, Boise, Idaho is really the big drug capital of America. Well, Dayton, Ohio has the highest drug rates in Ohio and is the drug capital of America. We got a lot of drug capitals in America. And they meant that. I mean, it was a heartfelt. The fact is, it's everywhere. And we need to redouble our efforts, not eliminate them. And there are ways we can do that.
So the ramifications of what you're describing here, Dom, it's astounding. I mean, how soon could these cuts take effect? Because we're going to touch on something that what happened in the UK later, but with the cuts that the administration are now trying to push through, how soon could this happen?
Well, they're happening now. The substance abuse mental health services, that division, the Department of Health and Human Services, Center for Disease Control and Prevention. Those people have been laid off already. I may have mentioned there was a woman on TV talking about she was in charge of the Community Coalitions program, 500 communities across the country that get grants to bring people together. I mean, we have one in one of the counties that I work in. They have an incredibly successful program. They put the school people, the treatment people, and the business people together for an after-school program where they get counseling and treatment and their parents can refer. And it's a prevention program. It's not saying just say no, which the research showed actually created more substance use than it did because there were kids exposed to drugs that didn't know about them. And it's not some condemnation, you got to do this or scared straight or what have you. It's the programs that help people make responsible decisions. And this is the consequences of what you do. Those are the programs that are being now. They've ended their funding. As I mentioned, Voices of Hope, who I work for recently in the last 4 or 5 months, got a grant from SAMHSA that was $300,000 plus for 3 years. That grant has been eliminated. So this is community-based nonprofit organizations and part of this system that are providing the direct services, have excellent track records, that are saving money. When Voices of Hope gives out Narcan, when Voices of Hope staff people provide and use Narcan on the person, it means a law enforcement officer, cop, emergency medical technician doesn't have to get on an ambulance and drive out and do it. We save them money. When we do it, that means that person doesn't go to the emergency room of the hospital to be treated for an overdose. That means we reverse the overdose here in our little nonprofit cubby, save that life, and also reduce the cost for that emergency room, which is already under stress. So, the cuts are just devastating. And it's not like if they happen, the problem's going to go away. The problem's going to get worse and worse for a greater number of people.
Absolutely. Is there anything that could be done to stop these cuts? Is there anything at all? Because
I don't know if we can stop them, but we can certainly oppose them. People that watch the news, there have been certain members of Congress that have been having town hall meetings where people in that area have said, hey, wait a minute, I don't want Medicaid. I'm worried about my Social Security. I just lost my job. I was fired as a federal government worker, and I was given 30 minutes to clean up my desk and escorted out by the police. I mean, I live across the river from a veterans hospital. The Veterans Administration has cut 80,000 employees. 80,000 veteran employees. So what some of us are doing, we're attending town hall meetings where we can directly question, express our views to those elected officials. Some elected officials are not having town hall meetings. I am either blessed or cursed to live in the district of Congressman Andy Harris. He's a Republican. He's the chairman of the Freedom Caucus, the U.S. House, which is the most conservative House members. He's also a physician. He was a physician at Johns Hopkins and stopped practicing once he got into politics. Well, Congressman Harris is not having town hall meetings. So 299 of my closest friends and I, 298 of my closest friends, because my wife, Suzanne, went with me, demonstrated outside of Congress, Congressman Harris's call. And I had a sign say, hey, Andy, tell Elon and his muskrats to keep his hands off Head Start, Social Security, Medicaid. And there were 300 of us there, and we've done that twice. And there was going to be another town hall meeting in the upper part of Maryland this weekend where Harris has been invited, maybe one show. So they're going to have a cardboard cutout of Congressman Harris there and have the town hall meeting. And they're attracting hundreds of people to that. So that's one thing you can do is communicate with the elected officials and let them know you don't like it. Two, one favorite tool that I like are letters to the editor of the local paper. And that's real easy to do. And you don't have to write the great American novel. You don't have to be an expert in statistics. You can write. I've seen them. This one was in the New York Times the other day. I'm a 78-year-old blind Vietnam veteran. And I just found out the program that I'm in, my health treatment program, has been terminated. What am I supposed to do? And if you're a parent with kids that's being affected by this, if you're a parent with an older person, my mother was on Medicaid for the last 13 months of her life. Not before then, just then, before she passed away. If you have an older person or a family member that's on Medicaid, getting treatment, even end of life treatment or geriatric care, this is my story. If you have a child that goes to Head Start or daycare program, child care programs, I have a 7-year-old kid. I'm a single mom. I work full time. I need this preschool program. I need this after school program. Just tell your story and say, the more we can make the cases there. And of course, responding to the House and the Senate and the Trump administration is critical, but also to your governor, your local elected officials. I live in an area, 2-county area that my programs serve, are predominantly Republican. They're almost all Republican, elected officials, city councils, county councils. And we're letting them know that if you endorse this action by the president, this is what it means for Harvard and Grace, Maryland. This is what it means for Upton, Maryland. This is what it means for Bel Air, Maryland. And bringing home the real life, day-to-day implications of what these highfalutin, maybe seem too far away policies mean is real important. I mentioned this on the hospital board. One of the things they're proposing is that nonprofit hospitals mandatorily declare themselves for profit, so they have to pay property taxes and other taxes. Well, hospitals are making money, maybe not a lot of money, but in rural areas are closing. I'm sure you have viewers in rural areas, and there are 700 rural hospitals that have closed in the last 3 years. And a lot of those rural hospitals rely, Chris, on Medicaid reimbursement. So where they are now is if the Medicaid is cut and the hospital is still open, they're going to have the influx of patients in the hospital they're getting money for, and there'll be more than 700 rural hospitals closing. So the impact of this, everything from what you eat and the air you breathe and the schools your kids go to and the healthcare treatment you can get and the recovery treatment you get is under threat. So we need to do something. And I know I go to some town hall meetings. People will say, I know this stuff that's happening is wrong. I watch the news or read the paper or I go on the social media. I'm so overwhelmed by all the issues. I don't know what to do. And my response to that is totally understandable. There's just a boatload of issues. Pick one or two that are really important to you and your family and your workplace or what have you. Focus on those 1 and 2 issues, and really put your best energy into that. Because for everyday folks that don't do the kind of stuff that I do for a living and you do for a living, it's too complicated. They've got real life situations to deal with, and they can't spend their 10 hours a day following the latest executive order by the president or what have you. But there's a lot of information available. And to get back to our primary function, treatment works, recovery is possible. If you can only say 4 words and you're involved in the substance use disorder field, treatment works, recovery is possible. And just hammering that mission home, that message home. And, if you belong to a faith-based organization, a church, a temple, a mosque, what have you, see if you can enroll the people there and your faith-based leaders into taking on some of these issues, because it really is a moral issue. And if you approach people that say, well, I don't give a damn about that, or let the people die, or lock them up, or why give them Narcan, just let them overdose and die. If they can't respond to the moral issue, respond to the economic issue. It costs more for you as a taxpayer, costs more for you as a customer for the various services you buy if we don't have these services than if we do have these services. So economically, it's better we do it the way we're trying to do it and redouble that effort rather than say, Elon Musk with the chainsaw. I don't know if everybody saw that video, but there was Elon Musk went to a national conference in DC and proudly was waving this chainsaw around, showing how he was going to cut all the programs. Well, I don't know what the definition of obscenity is. That would fall under my category really easily. And that's not consistent with the history of our country, and that's consistent with what I think are America's values. And, the days of rugged individualism are over. It's not because there aren't rugged individualists, there are. But the fact is we're dependent upon each other, and the quality of life for the kid that sits next to my kid in school makes a difference. The quality of life to the people that are in Walmart shopping, when I'm in Walmart shopping, makes a difference. And I think we've seen with the COVID epidemic that a lot of things can be contagious. And right now we have a contagious of ugly policies that we need to get a vaccine for. The vaccine for that is being active, standing up for our programs and what we believe in. I think what many of us think are right. I don't think it's right to deny food to people. I'm not gonna touch an immigration issue, but I think if a 10-year-old goes to the hospital to get cancer treatment, she should get her cancer treatment and not be put in a cage in Texas. I think older people that are on Medicaid need those services, and the program shouldn't be ended because it's going to happen. I live in Maryland, where Johns Hopkins University is. Johns Hopkins is one of the premier medical research institutions in the country. Cancer, diabetes, end of life, leukemia, all kinds of diseases. They've had 2,000 physicians at Hopkins cut by virtue of cancellation of the research and treatment contracts. There was a veteran on local TV. He's in stage 4 cancer. He was in part of an experimental group at Johns Hopkins doing this novel treatment because his cancer is so severe. That program's been ended. His treatment's been ended. Here's a guy in his early 40s who did 20 years in the military, has stage 4 cancer, was in a treatment program, was showing positive results, and overnight he gets ended. Not like, hey, can you want just 6 months, or can we make an exception? No. Clean out your desk in 30 minutes and go home and the program's over. So, I mean, we need to ask ourselves, is that the kind of country is that the kind of medical system we want? Is that how we want to treat our neighbors? Is that the way we want to be treated? My answer is no. And there are a lot of us, but we have to make noise. And we need to support those policymakers that understand how serious and drastic these problems are. And we need to challenge legally, respectfully, but strongly the politicians that think these are really good ideas. We're going to save a lot of money. The only money that's going to be saved are the taxes on billionaires that are going to get a tremendous tax cut. And that's where the Medicaid money is going, Chris. The Medicaid money is being cut so that tax increases for billionaires can be substantially increased. And this isn't some kind of exaggeration by some kind of leftist here. The Trump people and the billionaires are saying as much.
I know. I find it quite bizarre that people cheer this on without really understanding the full ramifications of what they're cheering on, because as soon as they're affected themselves, they're going to be screaming back at them. It's horrific.
Well, I think they're starting to understand it. I mean, I mean to interrupt you, but just one quick thing. I'm not trying to be partisan about this, but when President Trump ran as president, he was going to lower the price of eggs. He was going to lower the price of groceries. He was going to end the war in Ukraine, and he was going to do 5 or 6 other things the very first day. Mm-hmm. He didn't talk about cutting these programs. He didn't do the 6 things he said he was going to do. And he's doing 6 things he never said he's going to do. And tying back to your point, Chris, the people are starting to realize, hey, the price of eggs didn't go down. My SNAP fits are being cut off entirely. I really don't need Medicaid being cut off because my mother is in a senior citizens recovery home. So I think there's being some awakening there. But the election results are in, and the people have the power, and the people that think in ways that I don't think control the House, the Senate, and the White House. So we need to be good advocates and stand up for what we think is right and what's good for people.
Yeah, standing united is so important.
Absolutely,
it really is. I mean, it's not on the scale of what you're describing here, Don. But in the UK, we had. I told you I explained this when we first met. We had austerity in 2010 when the Tory government came in, and the Labour government, they weren't terrific, but they funded things. I was involved. I was working in the sector at the time. 2010, the government came in. They removed funding. They instigated austerity on a massive scale. Everything was ripped apart. Drug services were gone. Mental health charities were gone. But it was done slowly. And then in 2016, because of austerity, I believe we had a vote called Brexit because people wanted change, and quite rightly they wanted change,
Hmm.
but it wasn't the right change. And now, since then, I've thankfully been here in America for the last 10 years, but I've seen what has happened with the fabric of society in England. I speak to old colleagues in England as to what's happened. I've interviewed my old boss on there as well, on this podcast as well, and hearing how this is austerity and funding has just taken a wrecking ball to the country, and people are cheering it on still, and I just don't get it.
So there has not been an outcry from.
No, because the newspapers over there are so powerful. There's no the only voice is the right leaning, everything's fine kind of thing. Where society itself is just society help is just gone.
No, I'm sorry. I'm sorry to hear that. That's really.
No, it is. I mean, England used to be a very social country. We had things funded. When I think the NHS is going to be gone. I think in a few years. I also think social services, which funds all our elderly care, is going to be gone. That's going to be gone. And people just treat this as if it's nothing, and I just don't get it. And it's similar to over here, where they're just going, well, it's saving us a bit of cash, but they don't understand the long-term ramifications and when they get affected themselves.
Yeah, exactly. Other families. Yeah, I mean, we've had a couple surprise advocates here and elected officials, and one major reason is their son or daughter or their nephew or their cousin or their brother or their sister got heavily involved with drugs and fentanyl, and all of a sudden that opened new eyes for them. And it's unfortunate that's what it took. And it sounds like the situation in the UK is really terrible, and I'm sorry to hear that. But there's a cost for that. And if the social services are shut down, like you suggest, and the National Health Services either go away or so diminished, what are you going to do when you're walking the streets of London and there's people panhandling and dying on the streets and sleeping in the parks or whatever? I mean, they're not going to go away. Do you want to save them and make them healthy and taxpayers again, or do you want to compost their bodies in a field somewhere? It's the going of services can be improved, no doubt about it. Yeah, I think you were kind saying, the National Health Service, when you worked there, they'd had mixed record, but they did good and they funded programs. Well, that's a plus. That's a real plus. And if you take that funding away, the Voices of Hope, where I work, Chris, we have 52 certified peer recovery specialists. We go to the jails and get people after their discharge and take them to treatment or take them home. We go to drug courts and support them on their behalf. We provide transportation if they walk in our door and they go to a recovery center. We coordinate the treatment for them in the detox center, in a recovery house, in a long-term treatment center. We help them enroll in Medicaid. Sometimes they don't have a social security number or a driver's license. We take them and get that stuff restored. I mean, I'm not trying to be self-righteous or aggrandizing here. Voices of Hope and many organizations just like this in Hartford County help people rebuild their lives. And like I say to some of our elected officials who are not quite as empathic as they could be, say, well, we want to turn tax drainers into taxpayers. Oh, that's a good thing. Okay. If that's what it takes to protect the services, I mean, I'll say that. It's true. People that are going through emergency rooms, stuff like that, using Medicaid, getting food stamps or whatever, and not contributing to the tax system, it's a drain, but it's a well-deserved drain because they're trying to rebuild those lives. But the Recovery Friendly Workplace program that I talked about, we've helped people get sober and get jobs. And more importantly, we've reached out to the employee community, the Chamber of Commerce. Look, you can hire these people. So, it may be baby steps along the way, or maybe, pigs in the cribbage board, whatever kind of analogy you want to use, but we can make progress if we keep making progress. If we break the cribbage board in half and throw it in a wood chipper, we got nothing. And, we could be on the verge of that, but, I encourage all your subscribers and viewers to be active. I would be glad to talk with them or email with them. My email address is a real simple one. It's donmathis59@aim.com. MATHIS59@AIM.com. And, one thing we're doing here, Chris, I'm on the board of a local cable TV. We're doing a show on April 10th. It's called Facing Addiction in Hartford County. It's a family affair. And it's going to run one night. We're going to do it at an opera house, seats 200 people. It'll be on the TV show's Facebook page. It'll be taped and aired on our local cable station for about a month. And we have a panel. We have 3 panels. A fellow who's wrote a great book, Chasing the Sun, Dan McGee, who's a very successful businessman now, whose life story in addiction is just incredible. The book has sold over 100,000 copies on Amazon. He's going to speak up. We have panelists. We have a family guy in recovery who's reunited with his family, talk about what the problems were there. I have a drug court judge from Family Recovery Court, which helps people with addiction satisfy their criminal penalties and then get back with their kids and what have you. And we've got other therapists and experts, so we're in about an hour. But this is, and I'll send you the flyer on this, but this is the kind of thing that, again, other people can do. If you have a local cable station or local access station, and I've done 2 in the last month. Hey, this is what we do. This is our program. This is our service. This is there. I mean, by law, those stations can't get political or what have you. You can talk about your service, what you've done, what your success story is. Give those people a call, send them a note and say, we'd like to do a segment on your air. And it's funny, people say, well, whoever watches local cable TV? Well, once you're on it, the following day, 30 people will come up to you and say, hey, I saw you on cable. So that's an effective thing. And the other part that's good about that is policymakers and their staff really follow that stuff. They file local cable. They also file letters to the editor. I had a letter to the editor last year about a drug treatment program, and one of our state senators sent me an email the next day saying, thanks for doing this, so they pay attention. The more voices we can raise, the more constituents we can have, the more messages we can send to our community. Treatment works, recovery is possible. Here's my story. Here's somebody's story. Support these programs, oppose these cuts. We have a chance of surviving.
Yes. My goodness. I have one last question to ask you, Don.
Please.
And I think you can answer this beautifully. But can you tell our listeners how to, do you have a message for anyone listening to this podcast who is going through an addiction and just wants
I do, and it's a message I have the privilege of sharing every day at work and beyond is that, one, help is available. And if you need that and aren't getting it, send me an email. I have a national network, part of a national network of friends and providers in other states, but help is available. One, the message is treatment does work, recovery is possible. It's not an easy path all the time. I mean, I've worked with individuals that have had setbacks, relapsed 3, 4, 5 times. They've gone to treatment. My daughter, through marriage to my wonderful wife, Suzanne, was a heroin addict on the street for 10 years. Then screaming at her mother and 4G checks and what have you. She's 6 years sober now. She works in an autism program, working directly with autistic people and supervising other staff to do. So recovery is possible. Stick with it. And again, I work for a place called Voices of Hope. And that's the most important thing for people really in that jam, families in that jam, is have hope. There are other families that have gone through the same thing that your family has and that you have. There are lessons to be learned there. There are resources to be tapped. There are strategies you can implement both for your own self-care, as well as the family member you're worried about. So, I know substance use disorder is not pretty. I was in drug court. I worked in 4 drug courts, and I've seen all the downsides that addictive hijacked brain behavior can lead to. But as long as somebody is breathing, recovery is possible. And learn how to use Narcan if your loved one is involved with an opioid. Learn what the resources are available are. And I'm sure it's more difficult in some areas than others, but there are family support groups, mental health association chapters, other community-based groups, friendly health departments. There are advocates there whose lived experience can be relevant to you, helping your current living experience. And, I've seen people, I had one guy, the first time he came in, I just said, this guy is never going to get well. I mean, he'd smoke cocaine and shoot up meth right outside our office down the end of the shopping center before he came in. I said, James ain't going to make it. Well, James is clean and sober and reunited with his mom and family and is seeing regular visitations with his 2 daughters and is working part-time and hasn't used a drug. And I would just say, no matter how hopeless the situation may seem, not totally hopeless as long as they're still breathing. And stay with them the best you can. That doesn't mean enabling. That doesn't mean giving them money to go buy drugs. It doesn't mean driving them into the city so they can cop. It means staying with them in ways and not giving up on them. And that's hard, especially with time. It's hard. It doesn't get any easier, but there is a light at the end of that tunnel. Many people have made it, and you can too. Your family can too, with the right help. And again, Chris, you can send, I don't know how you transcribe or use that. You can send my email address around. I'm not big on getting texts because I got too many of those already and I'm more likely to lose them and get them. But send me an email. And if you're in Squirrel Tree, State X, I will find somebody in that state that you can talk to or refer to.
Well, thank you, Phil.
Thank you, Chris.
Don, it's been a real privilege and an honor to speak to you.
Right back at you, sir.
I'm in awe of your work. I'm in awe of your career and everything that you do. I was trying to keep up with the amount of work that you've done since you've been working in this sector, and it's quite astounding. You are helping saving lives on a daily basis, and it's just amazing. I'm in awe. So thank you so much. Just
to make your work a little bit easier, there are thousands of me's who are in doing that good work, and I'm proud to be one. And I thank you for your words.
Well, this is what the podcast is about, Don. It's about championing the work, and it's always a privilege to speak to anyone, but today has been very special for me. So thank you so much.
Thank you so much, Chris. Be well.
Thank you. You too.